Your Excellency, Mr. President of Faso, it should be recalled and emphasized that this high-level specialized care health infrastructure is, in fact, a direct and tangible materialization of your visionary and forward-thinking approach for a new Burkina Faso, particularly in the health sector. Namely, your goal is to guarantee and ensure equitable, fair, and just access to high-quality, comprehensive, and advanced care for all Burkinabe citizens, with a special focus on the average everyday citizen. Leave no one behind is not only your creed, but also your guiding principle and unwavering commitment to the people of Burkina Faso.
Nobody saw this coming. In a region where hospitals are often overcrowded and underfunded, Burkina Faso has just opened what is being called the largest hospital ever built in West Africa. And the man behind it, Captain Ibrahim Traoré, one of the youngest and most controversial leaders on the continent. Supporters say this hospital could end medical tourism and save thousands of lives. Critics say the real test hasn't even begun. So how big is this hospital really? What can it do? And why is the entire region reacting right now? Stay with us, because this project could change how Africa thinks about leadership and development.
When the doors of a vast new medical complex opened this week, the reaction across West Africa was immediate and intense. Images of sprawling hospital blocks, advanced diagnostic equipment, and long corridors designed to handle thousands of patients quickly spread across television screens and social media feeds. For many observers, the surprise was not just the scale of the project, but the timing and the leadership behind it. At a moment when much of the region is struggling with economic pressure, security challenges, and fragile healthcare systems, Burkina Faso has unveiled what officials describe as the largest hospital ever built in West Africa. At the center of this development is Captain Ibrahim Traoré, a young military leader whose decisions continue to reshape the political and development narrative of his country. Captain Ibrahim Traoré rose to prominence in 2022 following a period of instability in Burkina Faso marked by insecurity and public frustration with governance. As one of the youngest heads of state in the world, Traoré quickly became a polarizing figure. Supporters see him as a symbol of generational change and national assertiveness, while critics question the long-term sustainability of military-led rule. Against this backdrop, the completion and opening of a massive, state-of-the-art hospital carries significance far beyond healthcare. It is being interpreted as a statement of intent, a signal that the government wants to focus on internal development, social services, and national self-reliance at a time when Burkina Faso South choices are under close regional and international scrutiny. Healthcare has long been one of Burkina Faso's most pressing challenges. Like many West African nations, the country has struggled with underfunded hospitals, shortages of trained medical professionals, and limited access to specialized treatment. For decades, citizens who could afford it traveled abroad for complex surgeries, cancer treatment, and advanced diagnostics, often heading to countries in North Africa, Europe, or Asia. Those who could not afford such trips were left with fewer options, sometimes facing long waiting times or inadequate facilities at home. The new hospital, according to government officials, is designed to change that reality by offering advanced care within national borders. The hospital complex is enormous by regional standards. Spread across a large area, it reportedly includes multiple specialized departments, high-capacity inpatient wards, emergency units, and modern operating theaters. Officials say it was designed not just as a single hospital building, but as an integrated medical city capable of handling a wide range of health needs. From maternal and child health services to trauma care, oncology, cardiology, and advanced imaging, the facility aims to provide treatment that previously required overseas referral. The sheer physical scale of the project has led many commentators to describe it as unprecedented in West Africa, especially for a country with Burkina Faso's economic profile. Technology is a central feature of the new hospital. According to public statements, the facility is equipped with modern diagnostic tools, including advanced imaging systems, digital patient records, and specialized laboratories. These technologies are expected to improve both the speed and accuracy of diagnosis, a critical factor in treating complex and chronic illnesses. There is also an emphasis on training and knowledge transfer, with plans to use the hospital as a teaching and research center for medical professionals. If fully implemented, this approach could help address the long-standing shortage of specialized doctors and healthcare workers in the country. Beyond technology, capacity is one of the hospital's most striking elements. The number of beds, treatment rooms, and operating theaters reportedly far exceeds that of existing facilities in Burkina Faso and rivals some of the largest hospitals in the region. This capacity is intended to serve not only the capital and surrounding areas, but potentially patients from across the country and even neighboring states. In a region where population growth continues to outpace healthcare infrastructure, the ability to treat large numbers of patients efficiently is a major advantage. The political significance of the project is difficult to ignore. For Captain Traoré and his administration, the hospital stands as tangible proof of governance focused on public welfare rather than rhetoric alone. In a region where citizens often express frustration over unfulfilled promises, visible infrastructure projects carry considerable symbolic weight. By prioritizing healthcare, the government is tapping into one of the most universally felt needs of the population. Illness, childbirth, and emergency care touch every family, regardless of political affiliation, making healthcare investment a powerful tool for building legitimacy. Economically, the hospital could have far-reaching effects. Medical tourism has long been a financial drain on West African economies, with millions of dollars leaving the region each year as patients seek treatment abroad. By offering advanced care at home, Burkina Faso could retain more of that spending within its economy. The hospital itself has already created jobs during construction and is expected to employ a large workforce of doctors, nurses, technicians, administrators, and support staff. Indirectly, it could stimulate related sectors such as pharmaceuticals, medical equipment supply, transport, and accommodation. Socially, improved access to quality healthcare can transform daily life in profound ways. Reduced travel times, lower costs for treatment, and better outcomes can ease the burden on families and communities. For rural populations, who often face the greatest barriers to care, a well-equipped national referral hospital can serve as a lifeline when local clinics are overwhelmed or under-resourced. Over time, this can contribute to improved life expectancy, lower maternal and infant mortality rates, and better management of chronic diseases. The regional reaction to the hospital's opening reflects its broader implications. Across West Africa, governments and citizens alike are watching closely. Some see the project as an example of what is possible when political will is aligned with development priorities. Others are more cautious, emphasizing the importance of long-term funding, maintenance, and professional staffing to ensure that such a large facility does not deteriorate over time. There is also discussion about regional cooperation, with the possibility that the hospital could serve patients from neighboring countries through formal agreements, strengthening cross-border health systems. At the continental level, the hospital feeds into a larger conversation about Africa's development path. For decades, African leaders have spoken about reducing dependence on external systems, particularly in critical sectors like healthcare. The COVID-19 pandemic exposed the vulnerabilities of relying on global supply chains and foreign medical infrastructure. Projects like this hospital are now being framed as steps toward greater self-sufficiency and resilience. Whether Burkina Faso can sustain and expand such initiatives will be closely watched by policymakers across the continent. Captain Ibrahim Traoré's leadership style adds another layer to the story. As a military leader in a region where coups have drawn international concern, Traoré faces constant pressure to demonstrate that his government can deliver stability and progress. Large-scale infrastructure projects are one way to do that, but they also raise expectations. Citizens will judge the success of the hospital not only by its size and appearance, but by its day-to-day performance, the quality of care, the affordability of services, and the fairness of access. There are also challenges ahead. Operating a hospital of this magnitude requires sustained investment, skilled personnel, and effective management. Recruiting and retaining specialists in fields like oncology, cardiology, and neurosurgery can be difficult, particularly in countries facing security and economic constraints. Ensuring that advanced equipment is maintained and upgraded over time is another hurdle. Without careful planning, even the most impressive facilities can struggle to deliver on their promise. Despite these uncertainties, The opening of the hospital has clearly struck a nerve. For many in West Africa, it represents hope and ambition at a time when positive news can feel scarce. It challenges assumptions about what smaller, less wealthy countries can achieve and raises questions about priorities and governance. Why have such investments been rare in the past? What conditions made this project possible now? And what does it say about the balance between security, spending, and social development? As the hospital begins operations, its real impact will unfold over months and years rather than days. Patients treated successfully, lives saved, and professionals trained will ultimately define its legacy more than headlines or ceremonies. Yet even at this early stage, the message is clear. Healthcare has moved to the center of Burkina Faso's national conversation, and the rest of West Africa is paying attention. In the end, the opening of what is being called the largest hospital in West Africa is about more than bricks, beds, and machines. It is about leadership choices, national ambition, and the belief that development can be driven from within. For Captain Ibrahim Traoré, the hospital is a bold bet on the power of visible progress. For the region, it is a moment that invites reflection on what kind of future West Africa wants to build and who is willing to take the risks necessary to build it.